for this video, I'm kind of lumping together a few odds and ends left over from the axial skeleton and then also going over the bone model for bone tissue. So the first thing I want to point out here is the hyoid bone. It is right here underneath the skull, hanging off the front of the vertebral column. The unusual thing about this bone is that it actually has no connections to any other bones. It's literally free floating here in the throat, held to the spinal column here by a few tendons and muscles and ligaments. Okay? So that is the hyoid bone. You only have to be able to identify it. The next thing I want to show you are the sinuses of the skull. So we have this skull that's been sliced sagittally, because remember, sinuses are chambers inside the bones. So find some landmarks that you recognize. This is the frontal bone right here on the forehead. Here, I'll turn it that way so you can recognize it. Okay. And so you see this little pocket right here inside that bone. So this would be the frontal sinus. Another landmark would be right here. Here is my lovely sella turcica and hypophyseal fossa, where the pituitary goes. Again, let me give you some, see, that's what it looks like. That's what you're used to seeing it, that angle. And so we know that we're in the sphenoid bone, and this area right behind it, this air pocket, would be the sphenoidal sinus. Now, between the eyes and behind the nose is where the ethmoid bone lives. And now we see it sliced open, and it has many, many, many air chambers in there that are known as the ethmoidal sinuses. And then this hole right here, if I stick the stick in, let me show you where it's coming from. Let me flip this over. So that hole is actually right in here. And this, of course, is the maxilla. Let me turn it back. So this hole right here is the maxillary sinus. So again, frontal sinus, sphenoidal sinus, ethmoidal sinuses, and maxillary sinus. Okay, set that aside. Now we're going to go to the bone tissue model and just go over some parts here. So each of these bullseye shapes is an osteon. We have a few osteons that have been pulled up to show you specific features, okay? So this is a big wedge of bone. There's the compact bone from the outside to here. And then over here on this side, we see the spongy bone lining the medullary cavity. So spongy bone is here in the shapes, and the shapes are called trabeculae. And this gray covering over them would be called the endosteum. Okay, then we have all of our compact bone. And then on the outside here, we have the bone covering that goes all the way around the bone, known as the periosteum. And it's 2 layers thick. We have a fibrous layer, we have a cellular layer, and it's attached to the bone by these white strings that are known as Sharpie's fibers. Okay, so now we're going to kind of focus in on the compact bone. So in each osteon, you have a central canal right here. And what would be through that central canal would be blood vessels. Now they're represented here by just a red tube. Okay, it's one there represented, one there. But every one of these osteons would have blood vessels inside the central canal. Now the central canals, those blood vessels run vertically. So if we go over here to the side of the model, you see this is a blood vessel from a central canal, and so is this one, and so is this one, and they need to be connected somehow. And so we're going to have a chamber, a canal that goes across these osteons. And so it has to poke its way through for these blood vessels to get across. So we're going to call those the perforating canals, because they're punching their way through the long axis of the bone. Okay, so we have our central canal, and we're going to build layers around the central canal. They're going to be called lamella. Now these layers, since they are arranged around a central point and they're all the same shape, these are going to be called concentric lamella. Now at the borders of the lamella, we're going to see these holes in the matrix known as lacuna, and inside those holes would be living osteocytes. Okay, on this part of the model, they represent those osteocytes as red little cells here. Okay, now they are living cells. They need connections to blood vessels and to get oxygen. And so we have these tiny little cracks inside each of the lamella that lead towards the center. And that's where we're going to allow nutrients and waste to pass through. And they're going to be called canaliculi. So central canal, concentric lamella, lacuna with an osteocyte, and those little cracks are canaliculi. All right, now we're going to build most of the bone out of concentric lamella, but there are going to be some places where we can't put a full circle, like here. So we're still going to lay down layers to fill in the gaps, but they're no longer concentric. They're kind of fillers, in-betweens. So these ones are going to be called interstitial lamella. All right? And then all the way on the outside of the bone, you see we have lots and lots of layers that simply go around the entire bone. Since we're assuming the shape of this bone is pretty much a circle if we cut through it, these would be going around the outside of the circle, and so we call these layers circumferential lamella. All right, I think those are all the odds and ends that we needed to pick up.